Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. A quick nod whether the audio visual is all good so that we can start with this session. All right, great. So, welcome to the today's YouTube live session where we are going to discuss the next topic in NF100. What is NF100? Basically, NEET PG FMGE top 100 topics, and we are on episode 67 where we are going to discuss the topic of respiratory regulation, particularly focusing on the neural regulation. Okay, so the centers in the brain which control the respiration, what is the function, transection at what level will cause what to the rate and depth of respiration, and the types of respiration is what we are going to discuss in the today's class. So all this we are going to learn conceptually and also with a lot of mnemonics, that is tricks on how to remember, because that is the most important thing that I believe we need to cater to as well, on the tricks on how to remember everything that we are reading. Okay, so a quick nod, a quick thumbs up, everyone here. Everybody is all set to start with the discussion of this session. All right. Before we start with the discussion of this session, let me also tell you that 12 p.m. every day we are having the KBMDs. What is KBMD? Basically, KBMD is Kaun Banega MD. Okay. So it is a Kaun Banega MD, which is basically live quiz with leaderboard. We have KBMDs based on mnemonics like we had today. We learned a lot of important mnemonics, and we also have KBMD, which are based basically on concepts like we had the concepts in renal, adrenal, and endocrine yesterday. Right, so we have the next KBMD tomorrow. So when are we meeting next? Is tomorrow 12 p.m. This is going to be on the app, and it's a free live class. So all of you can attend that class. You can use the code Dr. Nikita to unlock that class, the special classes. Let me also tell you that the 20% off on subscriptions is there only till tomorrow. Otherwise, routinely you get 10% off when you use the code Dr. Nikita or any other code. But now till tomorrow, you have 20% off on all subscriptions. And after that, we would be having a price hike as well. So make sure you are making the best of this. If you're planning to take a subscription, please make sure that you are doing it by tomorrow, because after that you would see a significant price hike. What are the batches running on the platform? Are basically, we have NEET PG 2023 batch where we have the theory discussion, right? All the important points, and then we will have the revision in this batch. We are also starting with the test and discussion batch, another batch for the repeaters who mainly want to focus on the MCQ discussions. All right. That is starting on July of 1st. Okay, July 1st. So in this, basically, we'll have test and discussion till October. And after that, we will do the high yield theory revision, basically then from November to December. All right. And as I mentioned, the iconic prizes are increasing soon. So make sure you make the best of this opportunity. You can take plus subscription, iconic, that is Unacademy with Prep Ladder, light, that is test series subscription, MBBS Prof 1 subscription is separate. And we also have UPSC CMS subscription. All right. Okay, so let's start with the discussion of this topic. Tell me the pre-session assessment question. What do you think is this answer to this question? Depth of inspiration is controlled by which of the following? Which of the following controls the depth of inspiration? Is it pneumotaxic? Is it posterior medulla? Is it apneustic center? Or is it pons? What do you think is the answer to this? Yes, so some of you say it is apneustic center and some of you say it is pneumotaxic center. The answer is apneustic center. I'll tell you the trick on how to remember this. Absolutely right, unknown person. And we'll come to the discussion of this and then we'll come back to this MCQ also. We'll come to this MCQ later on, which is the pacemaker regulating the rate. Okay, so now this is the table that you have, which is basically telling you the function of the various centers in the brain. Okay, the function of the various centers in the brain which control the respiration. Now remember that the respiration regulation, it can be voluntary or it is involuntary. What is voluntary control and what part of the brain does the voluntary control? Voluntary means under our control, that is basically the cerebral cortex. Okay, that is the cerebral cortex. So voluntarily we can hypoventilate, we can do the breath holding, or we can hyperventilate if we wish to do that, right? So we have a voluntary control, which is basically by the cortex, and involuntary control, which is basically done by the brainstem. That includes here the pons and the medulla. Okay, that is the involuntary control that is going on without our control. Okay, so this one, the 6 functions that you see, what are the pacemaker cells of spontaneous or automatic breathing? That is basically the involuntary control. What is the pacemaker cell? Remember, pacemaker for respiration. Okay, so basically we are talking about pacemaker for respiration. So remember, it is PRE, that's the pacemaker. So remember, it is PRE, pacemaker for respiration, that is the pre-Botzinger complex. Okay, that is the pre-Botzinger complex is the pacemaker. Which is the respiratory rhythm generator, that is basically which starts the ramp signal. What is the inspiratory ramp? When the inspiration starts by the pre-Botzinger complex, the pacemaker, the inspiration increases in a ramp manner. That's a step ladder pattern basically, and then it stops and then the expiration starts. Okay, so which one is the ramp signal generator? That is basically you have DRG and you have VRG. That is the dorsal respiratory group and the ventral respiratory group. What is the function of both of these? Which controls inspiration and which controls expiration? Which is inspiration and which is expiration? Remember, the trick here to remember is remember dive. Okay, remember dive. That means basically DRG is related to inspiration and VRG is related to expiration. Alright. And where is this DRG and VRG present? Basically, these are present in the medulla. Okay, the pre-Botzinger complex, which is basically a part of VRG here. And you have DRG, VRG, which are basically present in medulla. So remember dive, that is DRG is inspiration and VRG is expiration. This VRG is active only in the overdrive mechanism. That means not during normal respiration. But let's say when somebody is exercising. During exercising, when there is overdrive, that is the time when VRG, the expiratory regulation, comes into play. DRG is the routine one. The inspiratory, basically it controls the inspiration. The signal from the DRG basically goes via the phrenic nerve to the diaphragm. Diaphragm is supplied by the phrenic nerve. Right, the diaphragm is supplied by the phrenic nerve. Diaphragm is an inspiratory muscle. So remember, DRG sends a signal to diaphragm. The inspiration is starting. Can someone tell me what is the root value of phrenic nerve? What is the root value of phrenic nerve? Yes, what's the root value of phrenic nerve? Anybody? Remember, phrenic nerve, we said it supplies the diaphragm. So phrenic nerve basically keeps us alive. Okay, alive is 5. So remember, it is C345. Okay, the root value of phrenic nerve is C345. It is not C234. Remember, 5 keeps us alive. Okay, so C345 is the root value of the phrenic nerve. All right. Okay. Now, also remember in anatomy, an important question that phrenic nerve is present anterior to your scalene muscle, okay, the scalenus anterior muscle. So respiratory rhythm generator, inspiratory signal, that is DR. Hello everyone, am I audible and visible? Sorry for that interruption. I hope it should be fine now. Okay, all right. So the next point, which is that center which controls the switch off point of inspiratory ramp signal. And the second one is, which is the one which delays the switch off signal, that means it promotes the inspiration. Okay, so controls the switch off point of the inspiratory ramp signal. That means basically what it is doing, it is inhibiting the inspiration. So remember that here in the respiratory centers, basically in Pons, we have the PP Wale centers, that is the pneumotaxic center, and we have the apneustic center. Okay, basically in Pons, we have pneumotaxic center and we have apneustic center. So if this is the Pons, upper, above, in the upper part, we have pneumotaxic and then we have the apneustic. So basically pneumotaxic is sitting above the apneustic. It is controlling the apneustic. Okay, it is controlling the apneustic. How? It is inhibiting the apneustic. So imagine like this apneustic is us, right? A child, and this PTC, the pneumotaxic center, is like the parents sitting above the child. Okay, and controlling the child all the time. Like the child is saying, the kid is saying, I want to go out late night for parties. The parents said, no, not allowed. So remember that basically PTC is like the parent and APC is like a child, and PTC is inhibiting the APC. You can remember this as pneumotaxic. Taxic is toxic. Toxic to whom? Apneustic center. Okay, basically apneustic center. So pneumotaxic is inhibiting the apneustic center. So basically it is inhibiting the inspiration. The apneustic center wants to do the inspiration. It delays the inspiration ka cutoff. Basically it wants to prolong the inspiration, but PTC is saying no. Okay, PTC is saying no. So basically PTC is shortening the time of inspiration. So what is pneumotaxic center basically doing? By inhibiting the inspiratory signal, right? The switch off point, by the early switch off of the inspiratory signal, basically you will have increased respiratory rate, right? The respiratory rate will be more. Apneustic wants to prolong the inspiration. So basically apneustic increases the depth. That is where the first MCQ that I had put forward, that was, remember the mnemonic is PRAD. Okay, what is PRAD? That pneumotaxic controls the rate. Okay, basically it is increasing the rate, and apneustic is increasing the depth of inspiration. Okay, so remember pneumotaxic is rate and apneustic is increasing the depth. Is it understood by everyone? Yes, Daffy, absolutely right. That could be the other way that you can remember, that P is the principal and AP is the assistant professor, right? So the principal always inhibits the AP, controls the APs. Absolutely right. Okay. So now, so controls the switch off point. This is basically pneumotaxic center, which wants to delay the switch off signal and promotes the inspiration. That is basically apneustic center. So what do you mean by the term apneusis? Apneusis basically means prolonged inspiration. Okay, apneusis basically means prolonged inspiration. Now, inhibits the inspiratory discharge. Basically, this is the function of the vagus nerve. Okay, so when the lungs are stretching with inspiration, when there's a lot of stretching, we do not want more stretching to happen. You know, it's like a balloon. You inflate the air, but you do not, when you will inflate too much, then the balloon will burst. This is something that we do not want to happen with the lungs. Keep stretching, and finally they are bursting. We do not want that. So we want to inhibit the inspiratory discharge. So this is done by the vagus nerve. So basically the lung stretching stimulates the vagus and that inhibits the inspiration. Okay, that inhibits the inspiration. So that, remember that vagus is also inhibitory to the inspiration. So basically the pneumotaxic center is like the parents and the vagus is like the uncle and the aunt who are also trying to control the child. Okay, so basically you have parent, that is pneumotaxic, and you have vagus, who's the uncle and the aunt, both of them trying to inhibit the apneustic center, basically both of them inhibiting the inspiration. Everybody is clear so far with whatever we have discussed here? A quick thumbs up so that we can go to the next part. Right, so basically you have a brainstem, that is the pons and the medulla. Pons will have pneumotaxic center, apneustic center. Medulla will have the DRG and VRG. VRG has pre-Botzinger complex. Okay, that is the pacemaker. DRG is inspiration, VRG is expiration, that is dive. Pons mein it is PRAD. Pneumotaxic controls increases the rate, apneustic increases the depth. And apneustic is the child which is controlled by pneumotaxic, that's the parent, and the vagus which is the uncle. Okay, so both of them basically inhibiting the apneustic center. Okay. Now, so this is the complete table that is given, the functions of the various centers. So pre-Botzinger is the pacemaker of respiration. DRG is basically inspiratory. VRG is the overdrive mechanism. Pneumotaxic inhibits the apneustic. Apneustic promotes the inspiration and vagus inhibits the inspiratory discharge. Now look at this image basically which shows the functions, the location of the centers. So cerebrum basically is the voluntary control. Okay, that's the voluntary control is by the cerebrum. Pons and medulla basically is the involuntary control. So in the upper pons we have the pneumotaxic center. APC is the lower pons. Okay, so pons has the pneumotaxic center and the apneustic center. In the medulla we have the DRG and the VRG. Okay, so now tell me, coming to the next discussion here, very very important. When does the apneusis develop? At what stage is the transection? Is the transection above the pons? Is the transection in the mid pons? Or is the transection below the pons? And basically with the vagus intact or with the vagus cut? When will a patient develop apneusis? Okay, let's say in an experiment. When will you see that the animal is developing apneusis? When the transection is above pons, in the mid pons, below pons, with vagus intact or with vagus cut? When will there be apneusis? Think logically on what we have discussed so far. Right, what transection, at what level, and whether with vagus cut or with vagus intact? See, apneusis basically means that the apneustic center is overactive. Right, the apneustic center is overactive. Absolutely right, Kajal. So apneustic center we said is like a child. So when will the child become autonomous? Child, बच्चे की मर्जी कब चलेगी? When the control is lost by the parent and also by the uncle and the aunt, right? So basically both is gone. The pneumotaxic center connection is also gone with the apneustic center. The vagus connection is also gone to the apneustic center. So basically the vagus is also cut and the pneumotaxic connection with the apneustic is also cut. Now where is this pneumotaxic? Where is this apneustic? It's present in the pons. So basically you are disturbing this connection between the parent and the child so that the parental inhibition is gone. So when the transection is at the mid pons level with the vagus cut, that is when the child will become autonomous. Okay, that is when the child will become autonomous. So that is mid-pontine with the vagus cut. Right, so let's see the various transection levels. Now, if there is a transection above the pons, right? So you have pons, medulla, and we have the cerebral cortex, okay? And we have the cerebral cortex. If the transection is above the pons, so pons and medulla are intact, the brainstem control is intact. So what will happen is the regular breathing will continue because this is intact as a whole. Pons and medulla is intact. So with the vagus intact, everything is intact, so nothing will happen. But if you cut the vagus also, what is the vagus? Vagus, we said, is the uncle aunt, basically trying to inhibit the inspiration. So when the vagus is cut, the inspiration will increase, right? The inspiration will increase. So with the vagus cut, the additional effect will be the depth of inspiration increases, right? The depth of inspiration increases because the vagal inhibition is gone, okay? If it's the mid-pontine level, okay, if it's a mid-pontine level with the vagus intact. So mid-pontine, basically you have PTC and APC, you are disconnecting the two, but the vagus is intact. So vagus is controlling the apneustic center even if the parents are not there. The uncle is there to control the apneustic center. So the regular breathing will continue. But now even if the uncle, the vagus goes, so there's nothing to control the apneustic center. So apneustic apni marzi chalayenge. So there will be apneusis. This is very, very important question. So apneusis develops when the transection is mid-pontine with the vagus cut. Parents and uncle both are gone, so no inhibition, apneusis develops. Now the next point, if the transection is between pons and medulla, okay, basically if the transection is here, pons and medulla. So in that case, what will happen? The rhythm is maintained because basically the rhythm is in the medulla, that's the pacemaker there, right? So there will be rhythmic respiration, but because the pons ka connection is gone, pneumotaxic, apneustic is gone, it will become irregular. It will be irregular, but the rhythm will be maintained, okay? Now, if there is a transection below the medulla, so basically all the connections going to the lungs will be gone if the transection is below the medulla. So basically here the spontaneous respiration will stop. Now it will be only the cerebral cortex which will control the breathing. That means only voluntary control will be there. Involuntary control will be lost. Okay. So the spontaneous respiration will stop when the transection is below the medulla. This is something which is called as Undine curse, right? There is this historical story of Undine curse where the transection is below the medulla, but the cortex, the voluntary control is there. So all the time the patient has to be awake for the voluntary control. If the patient goes to sleep, the voluntary control is gone, the involuntary is not there. So the respiration will stop and the patient will die. Okay, so that is what is Undine curse. Below the medulla, involuntary control is not there, but voluntary control is there. Is this clear with everyone? What happens in the various transactions? So tell me, what do you think will be answer to this question? Which of the following is true about Undine's curse? It's basically a curse where the patient has to be awake all the time. Right? Agar galti se so gaye, then you are gone. Which is true about Undine's curse? Absolutely right. So basically remember, in Undine is all the time the patient has to be awake. So such patients can stay alive by breathing voluntarily. The voluntary control of respiration is not disrupted. The voluntary is intact. The automated control is what is disrupted. The involuntary is gone. It is seen in spinal poliomyelitis? No, it is seen in bulbar poliomyelitis. The medulla, the connection there is gone. So it is seen in bulbar poliomyelitis, not the spinal poliomyelitis. So remember, automated, that is involuntary control is gone. The involuntary control is not intact. Okay, so that is Undine's curse. Okay, that is Undine's curse. Okay. So everybody is clear with the respiratory regulation from the neural centers, the pons, the medulla and the cortex, and the various transactions. Above the pons, Nothing will happen. There will be regular respiration. If the vagus is also cut, the depth of inspiration will increase. Mid-Pontine, with the vagus intact, it will be regular. With the vagus cut, apneusis will develop. Then between the pons and the medulla, the rhythm will be maintained, but it will be irregular. And below the medulla, it will be completely gone. The spontaneous respiration will go off. Okay. Now, coming to the last point of discussion here, that is the types of respiration. Okay, how do you identify the Cheyne-Stokes, the Biot's, and the Kussmaul's breathing from the graphs that are given? Okay, how do you identify the type of respiration? So look at this image. Like A is normal, you have image B, you have image C, and you have image D. A is basically, if I tell you that A is the normal respiration, tell me what kind of respiration is the image B? Is it Kussmaul's, is it Biot's, or is it Cheyne-Stokes? Yes, what kind of breathing is the image B? Absolutely right, Leo Mukesh. So, in the imagery, what you are seeing is there is this waxing and waning type of respiration that we are seeing. It is increasing and then it is decreasing. So, basically, this crescendo decrescendo type of respiration. Okay, the crescendo decrescendo type of respiration, this is called as Cheyne-Stokes respiration. Okay, this is called as Cheyne-Stokes respiration. Remember CES, that is crescendo decrescendo. Okay, the next one in the image C that you see, what is happening here? There is this period of hyperapnea, right? The increased depth which is there, and then there is apnea. Again, there is hyperapnea, and then there is apnea. So basically, this is called as Biot's breathing. Remember, Biot's is like bi, which is biphasic. Okay, Biot's breathing is biphasic. So there are opposite phases coming. Hyper, then apnea. Hyperapnea, then apnea. Okay, so basically this is hyper and then there is apnea. So it is biphasic. So this is Biot's breathing. Okay, this is Biot's breathing. And the last one, where you see that the rate is increased, the depth is increased, that is basically Kussmaul's respiration, Kussmaul's breathing, right? अगर किसी ने आपको बोला कि कसम खाओ, ठीक है, एंड आपने you've said something false, झूठ बोला, और किसी ने बोला कि कसम खाओ, you know how we get scared and then our breathing increases. So you can remember कि जब कसम खानी होती है तो respiration increases. That is Kussmaul's breathing. And where do we see Kussmaul's breathing basically? You must have read about Kussmaul's breathing very commonly in diabetic ketoacidosis, right? Basically, any cause of metabolic acidosis will cause Kussmaul's. Why? We discussed in the today's KBMD also when we were discussing acetazolamide mountain sickness. Metabolic acidosis, how will the body compensate? The body will compensate by causing respiratory alkalosis. Okay, so basically we want respiratory alkalosis. When will the respiratory alkalosis develop? When the patient hyperventilates, right? When the patient hyperventilates. So that is why any cause of metabolic acidosis basically will have hyperventilation, that is Kussmaul's breathing. Okay, so कसम लेते हैं तब होता है hyperventilation. So that is Kussmaul's. Okay, that is Kussmaul's. So remember this point. That is Cheyne-Stokes is crescendo decrescendo. Okay, Cheyne-Stokes is crescendo decrescendo. Biot's is biphasic, and Kussmaul's is basically hyperventilation. Okay, hyperventilation. How does it produce? How does it produce basically respiratory alkalosis? How does hyperventilation produces respiratory alkalosis? So whenever there is hyperventilation, what happens to the PCO2, the PaCO2? the CO2 washout is more, right, with hyperventilation. So PCO2 decreases, right? Remember, when the PCO2 is decreasing, basically the pH will increase. It is opposite. All of you remember the mnemonic from acid-base disorders, the NF100 previous episode. Respiratory में the changes are opposite. If the PCO2 is decreasing, the pH will increase. pH increase basically will be alkalosis. Because of PCO2, this is respiratory, right? So basically hyperventilation will cause CO2 washout, decrease PCO2. So increase the pH, that is respiratory alkalosis. Okay, that is respiratory alkalosis. All right. So yes, that was about the discussion of the today's topic. So going back to the question that we had, the first one, right? So everybody's clear with the answer now. The depth of inspiration is controlled by apneustic center. Just remember the mnemonic, that is PRAD. That is pneumotaxic controls the rate and apneustic controls the depth, right? Everybody remembers that, because apneustic basically prolongs the inspiratory signal, right? It prolongs the inspiratory signal. So the depth of respiration, inspiration increases. Okay, apneustic center is like the child, controlled by PTC and the vagus. Okay, PTC and vagus. Okay? And pacemaker regulating the rate of respiration. Pacemaker regulating the rate of respiration, which is the pacemaker. Pacemaker of respiration is pre-Botzinger complex. Okay, pre-Botzinger complex, which is basically present in the medulla. Okay, which is basically present in the medulla. All right, that is your pre-Botzinger complex, which is the pacemaker. Okay. All right. So yes, that was about the discussion of the today's topic for respiratory regulation. I hope you have understood this topic. Remember the mnemonics: dive, remember PRAD, and remember the APC is the child, controlled by the parent, the PTC, and the uncle, that's the vagus. Okay, remember these three important tricks basically to remember this topic. Okay, so when are we meeting next? We are meeting next tomorrow 12 p.m. for KBMD. That's a live quiz, fun-filled quiz with a lot of concepts and mnemonics. So we'll be seeing a lot of concepts in the tomorrow's KBMD at 12 p.m. on the app. Free live class. See you there at 12 p.m. Till then, goodbye, take care, and keep studying, keep revising, and keep winning. Thank you so much, everyone, for joining in, and good night. NEET PG aspirant, the TND course will be under plus or iconic. See, the difference between plus and iconic basically is in iconic, you will get everything of the plus. Along with that, you will get access to all the prep ladder resources also, right? So for the plus ones will be available in iconic as well. Okay. Okay. Any other queries before we call it off for the day? Okay, so thank you so much, everyone. Good night, take care, and see you at 12 p.m. tomorrow for